Did you know that nurse practitioners provide more than 290,000 solutions to healthcare shortages in the United States? These nurse practitioners provide much-needed, high-quality, cost-effective, patient-centered care. Hi, my name is Sterzinger, and I'm from the Minnesota Senior High FCCLA Chapter, Level 2. The career I chose to investigate is a nurse practitioner. This is my table of contents. My concern and major goal was choosing a future career that will link to my interests, skills, and values. My plan for this project was to take a variety of career assessments to discover careers that align with my interests. Secondly, I plan to research and compare potential careers. Next, I decided on an occupation to further research and watch a video. Lastly, I wanted to interview health professionals. To put my plan into action, I completed a variety of career assessments using the Minnesota Career Information System website. Secondly, I researched more information based on the results from my assessments. Thirdly, I compared careers and decided on a nurse practitioner. Lastly, I did more research on a nurse practitioner, watched a video of a nurse practitioner practicing her profession for a day. I also interviewed 2 healthcare professionals. This is my evidence of online project summary submission. The Minnesota Career Information website helped me explore multiple occupations that correlate with my interest and work values. The results of my first assessment listed health science, law, public safety, corrections and security, and education and training as my top 3 career clusters. In my second assessment, the results showed that I should use social, investigative, artistic, and enterprising interests to explore occupations. The last assessment exhibited the levels I was at for workplace employability skills. It showed that I was proficient in intergenerational and cross-cultural skills, professionalism, legal and ethical practices, collaboration, and thinking and innovation. It additionally displayed that I was knowledgeable in complex communication, organizational culture, self-direction, and financial practices. The roles of these assessments is to give me a direction and guidance to choose my future career. In addition, they led me to working at the local nursing home as a dietary aide. During my time there, I learned things such as nutrition and food solidification. These assessments also inspired me to become a certified nurse assistant, or CNA. Nurse practitioners serve as primary or specialty care providers. They treat and care for patients with a broad range of health issues. Nurse practitioners are registered nurses with additional training for specialties such as emergency care, family medicine, women's health, pediatrics, and geriatrics. Some of the duties and responsibilities nurse practitioners perform are examining patients and discussing any problems, ordering x-rays and other tests, and interpreting those results. When needed, the nurse practitioners prescribe medicine and may provide counseling and may perform school physicals. To be nationally certified, nurse practitioners must be a registered nurse, hold a bachelor in science and nursing, complete a nurse practitioner focused graduate degree, and successfully pass the nurse practitioner board certification exam. Nurse practitioners are advanced practical registered nurses. They can also acquire a doctorate degree, which can help expand their career responsibilities even further. Nurse practitioners earn an average of $119,000 per year. They are on the list of the top 10 most in-demand jobs in the United States. I interviewed 2 healthcare professionals, an emergency physician and a physician's assistant, since I could not interview a nurse practitioner. The first question I asked both professionals was, "What are the rewards in your chosen career?" Both respondents replied that helping others is the ultimate reward. And they also said that the job was interesting because there are always problems to be solved. They also stated that their career has come in handy in unpredictable situations. The second question I asked was, "What are the challenges in your chosen career?" They replied that you persistently think about your patients, especially those who may become violent due to mental health or drug use. The third question I asked was, "What does a typical day in your life look like?" The 2 respondents answered that they normally see 15 to 40 patients in an 8 to 11 hour shift. Patient conditions range from moderate to critical, from infections to chronic health conditions such as hypertension and diabetes. The last question was, do you have any recommendations for me as I pursue the career of a nurse practitioner? Respondents recommended that I work under many different physicians and I have good grades to go to a good college with a good nursing program. The mncis.intercareers.org is a website I used as one of my resources for this investigation. The website consisted of a variety of assessments that exhibit your interests, skills, and values. The website allows you to combine the results of each test and list careers that fit the individual best. The second research method I used was a video titled Family Nurse Practitioner Day in the Life, which allowed me to have an insight into the career I've chosen. The third research method I utilized is a website from the American Association of Nurse Practitioners. This website gave me information about the qualifications, licensing, practice locations, training, and education of nurse practitioners. The websites from American Academy of Emergency Nurse Practitioners, the Mayo Clinic, the Regis College, and the National Association of Pediatric Nurse Practitioners all gave me similar information. I have limited experiences with businesses, industries, or agencies, although I live and work on a farm, which has allowed me to have some experiences. One major experience I had on the farm is planting, harvesting, and selling grain. This experience has taught me not to procrastinate on things that need to be done right away. Two other major experiences the farm has offered are chores and rock picking. These have allowed me to form a good work ethic. I was also taught to be cautious with my money through the experience of buying and selling my goats, sheep, and cattle. Being a caretaker of sheep, goats, and cattle has granted me the ability to learn how to nurse the animals back to health when sick. I have been able to babysit, and that gave me the opportunity to learn to stay calm and patient during tough times. I currently work at the local nursing home as a dietary aide, and that the job is a gateway into the healthcare system. I am also taking a CPR class. I plan to become a CNA this summer. The CPR worksheet is a future test for certifying in CPR. This class will play a major role in my future career. For example, I learned how to splint, perform CPR, and properly take care of burns and wounds. The biology worksheets are about mitosis in cells. This helps me get a basic understanding of the body's function. For example, I learned that cancer is formed when uncontrolled cells keep undergoing mitosis. This eventually leads to a tumor if not treated. The last example is a health worksheet describing the different chemicals and drugs and how they affect the human body. This knowledge will help me identify the cause of harm for my future patients and treat it. These are my examples. The Family Consumer and Science coursework has been used for my selected career by the babysitting lesson in 7th grade. During the lesson, I learned how to take care of an infant and toddler. In addition, I learned that the safety measures needed for children, such as not to shake the baby and to cover electric plug-ins. I also learned the warning signs of child abuse. This knowledge will help me identify the abuse on patients and get the help they need. I also took a child development course, and I learned about genetic disorders and birth defects, and what happens in each trimester of pregnancy. This knowledge will help me in the future to identify and treat problems accordingly. I also learned nutritional health for pregnant women, which has granted me information that will help me prescribe the correct nutritional supplements for my future pregnant patients. One of my career goals is becoming a CNA. My next goal is to take college classes during my junior and senior year of high school. I intend to take classes that will lead me to becoming a nurse practitioner. All the goals stated will help me reach my final goal, and that is to go to college at either University of Mary in North Dakota or South Dakota State University. This is my bibliography. So one skill I've improved on is planning for the future. This skill will help me in the future by allowing me to properly organize my schedules in certain time slots. and having to decide on major decisions that would affect my future has caused many big challenges for me throughout my project. I addressed this obstacle by weighing out the positive and negative outcomes of each decision. Thank you for listening.